Welcome back to the Morning Boat. My name is Eric Abelos. As promised, we will continue to provide you the most up-to-date information as possible about the local COVID-19 response in our community. In-house today, we have special guest, Dr. Harrington. Hello, doctor.
Good morning.
So, can you tell us more about what this safer at home means? What does that look like, and what does it even mean?
Yes, that's the term applied to this, what you would call this next phase of the return of society's activities after we had the stay-at-home order. The idea was that we would take graduated steps of kind of unpeeling the restriction layers so that we could do it in a deliberate way, be thoughtful about which activities we resume at what level and with which mitigation restrictions. And then also to give time to assess. Unfortunately, there's a lot of guesswork in what the state and even we do locally. And so not always knowing for sure what the impact is going to be. There's a desire to do a moderate step, have time to assess that, and make sure that we didn't set things off and see a surge in cases again, or somehow open up the disease to our communities again. And then after each of those stages, then presumably we have the opportunity then to further peel back the restrictions. And, this is an effort to try to find out how or what the sweet spot is for resuming as much of life's activities as normal, but still keep prudent restrictions in place to mitigate the spread of this disease.
That's a great answer. So then my question is, after we relax the restrictions that are currently in place, just ever so slightly, how long then do we go from step to step of relaxing those rules before we can really determine the effects of those restrictions?
Right, and this question comes up often, and my answer to that is based on my understanding from a medical perspective. It has to do with the timeline of this disease. We know that on average, it takes people about 5-6 days to develop symptoms when infected. Then we also know from that point that it probably takes on average another 9 days or so for people then to be hospitalized. And of course, there's a period of days after that where we see the average death rate. So as we measure the impact of this disease in our activities, we're looking at number of cases, we're looking at hospitalizations, we're looking at deaths. So I just detailed that process is a timeline over, practically speaking, 2 to 3 weeks. We won't be able to adequately judge our actions for 2 to 3 weeks because of those explanations. And therefore, if we're trying to assess what we did on May 1st, we won't see all that impact until the third week or so of May, for example. I've also experienced here, as we did employ the safer to home guidelines, the governor rolls out his executive order, but it doesn't have all the details. And then after that, there's a process where there's further dissemination of those guidelines from the State Department of Public Health. And that kind of rolled out over several days. So it's not even the idea that the governor kind of flips a switch and then the next day everything's full up. Rather, it takes us in all the communities days, if not even weeks, to kind of get up to the new limits. And then from there, we actually want to assess what we're doing. So I think that this rough idea that we take a month between phase changes based somewhat on some understanding of how this disease progresses with infection and development of symptoms, and then what our measurable metrics are.
Yeah, tough decisions have been made. We've taken here in Routt County drastic measures, but I feel as though we are seeing the benefits of those drastic measures. Fortunately, we are not seeing the same numbers that you are seeing in like Italy and New York, these uncomfortable numbers. But I think it's because of the big steps that we've taken as far as like shutting down all of Routt County. Do you have any how resistant are you to like jumping into the next phase?
Oh, I mean, I'm a glass half full guy. I say that sometimes. I'm looking at how can we make things happen, not why we can't make things happen. I'm not going to accept that necessarily all of our current low disease prevalence is due to public health activities, but I do think we've contributed to it. I'll be happy just to say it was from luck, but whichever, we got to this point now where we seem to have a safe, low prevalence of disease in the community, which has allowed us to start advancing. The process now, I would say, is focused on discovering where the sweet spot is, so to speak. We want to open up as much as we can, and we think that's important both from a public health standpoint as well as just for society's impact. But we want to make sure we do that in a safe, deliberate way. And when I use the word deliberate, I mean that it's thoughtful, that we've done our best to sort out what risks we can accept, and to incorporate the lessons we have learned so far in this disease, so we're not either repeating history or making needless mistakes that could even cost lives.
With things that we can still do to protect ourselves and protect others in our community, what are those things? Like continuing to wear face masks and obviously wash your hands. What other things are there that we could do to actively participate in?
Right. So as you mentioned, the face mask thing does matter. It's a nuisance, but compared to all the other things that we've had to do, I think it's relatively easy compared to shutting down business and so forth. Hygiene is important. Washing hands multiple times, because again, you don't want to be getting things into the mouth, nose, or eyes, and cleaning surfaces. Social distancing, that in all the models and by the experts, clearly is the biggest thing that we do that matters for reducing the spread of this disease. So even though we have gotten into a better place, people unfortunately need to continue that practice. And then, the idea that I think one of the changes in our culture is going to be the idea that you work when you're sick. I think that's over, and it needs to be over. That is an important part, and especially as we get back in the next cold and flu season, is what do people do when they're not feeling well? We've all gone to work sick. Well, we all need to adopt a different culture with that.
If somebody's watching this at home right now and they want more information, Dr. Harrington, where can they find that?
Well, locally, we try to put up information on the county webpage. That's one place. The newspaper, of course, every day is coming out with information. We do have press releases we put out. There are obviously lots of state and federal sources. I myself rely a lot on the Colorado Department of Public Health and Environment for a lot of the information that we need to use locally. And their information tends to be more directly relevant to our county. So I do often recommend people go there, especially because that applies as well to the governor's executive orders, as well as the guidelines from the state that we try to follow. And then the federal level, certainly the CDC, FDA, any of the universities tend to put out information. University of Washington's had a lot of interesting modeling information, as has Johns Hopkins University.
And what was the website again for the local Routt County information? Do you have?
Yeah, so if you just Google Routt County, you'll get the Routt County website. We have a section and a tab on there that says COVID-19 information.
Okay.
To that, we have our county guidelines and orders on there. We have tools for businesses and activities to do their best to mitigate the disease. We have data as it applies to our local county. We have frequently asked questions. So our public information office and Joint Information Center have been working. They work every day hard to try to keep that update and answer questions as it relates to COVID-19.
Wonderful. That is some great information. Thank you again so much. I know right now is a very, very busy time for you. And so thank you for taking your time to come on air with me and talk today. I really appreciate it.
Thanks for this opportunity to keep spreading the message and to make everybody a part of the same effort to keep this disease beaten down and to get our lives back to normal as much as possible.